The Senior Rehab Podcast is sponsored by Great Seminars and Books. If you need high-quality geriatric con ed that's worth your time and money, check out Great. Owned by the living legend Carol Lewis, Great offers courses and products created by recognized leaders in geriatrics. Learn the most effective techniques for diagnosing and treating your patients. Just go to seniorrehabproject.com/great and get $25 off by using the code SRP25. Hit me!
This is a Senior Rehab Podcast, the podcast for rehab clinicians that want to better serve older adults.
I'm Erin Carey.
And I'm Tali Spaceman.
You're listening to Senior Rehab Podcast Shorts. So today we are going to be talking about the PRISMA Guidelines and why they matter to you.
Why do they matter? And more important, what are they?
So that's a great question.
Thank you. I ask all the right questions.
Good. All right. So first, Tali, what can you tell me about the PRISMA Guidelines? Like, what do you know from baseline?
I had know nothing. Actually.
Have you heard of them before?
No.
Well, the PRISMA Guidelines are the guidelines used to assess the quality of systematic reviews and meta-analyses. When I say assess, this is done at the journal level. So most large journals do not accept systematic reviews for review for publication unless they follow the PRISMA Guidelines. So this is pretty important. These are quality control of these really big articles about things that affect all of us.
Yeah, and actually now it kind of like shaken my memory. I do know what they are.
Cool. So back in 1987, Cynthia Mulrow, a physician from Texas, looked at 50 review articles from 4 leading medical journals, including the Journal of the American Medical Association and the New England Journal of Medicine, from the previous 2 years, and found that they were very unclear, and they did not assess the quality of their primary articles. Tali, why do you think that this is a problem, the journal articles being unclear and not assessing the quality of the primary sources?
Well, mostly because we trust those things as clinicians.
Right.
Part of our advance as medical professionals is based on those journals, based on sharing the information and sharing information that we know is quality information.
Yes.
When something like that is not, you took a source that is garbage or you took a source that is based on something very incorrect, that's created a problem for us.
I agree. Yeah. And this is actually around the time that clinical practice guidelines were being developed from these systematic reviews and meta-analyses. So everyone's practice across the medical field was being influenced by poor quality and unclear literature sources.
So we were building fancy and very beautiful buildings on a basis that is
sand. So then later in 1987, another physician named Henry Sachs and his group published an article called Meta-Analyses of Randomized Controlled Trials, which assessed the quality of previously published meta-analyses based on 6 criteria. Those 6 criteria were study design, combinability, control of bias, statistical analysis, sensitivity analysis, and application of results. What do you think they found?
What is combinability?
I think that is a somewhat antiquated word for being able to put results together in order to assess the same thing. You know how with meta-analyses, they pool all of the subjects together to make one large sample size? That's like the more compatible they are to be combined would be a measure of their combinability. However, I've honestly never seen that word before.
Okay.
Reading for this episode.
Okay, it was like just like you. It was a word that I didn't know. So.
Yeah, definitely. So then he found that only 28% of the articles, all the meta-analyses that he found, addressed all 6, and they did not address all 6 satisfactorily. Was the word they used as well. So later, a different person found the same result. Was that these meta-analyses that were being used to determine clinical practice guidelines were unclear and poor quality. Fast forward to 1996, emerged the Quorum statement, and Quorum stands for Quality of Reporting of Meta-Analyses. So this was constructed originally to address only meta-analyses, but they found that similar concepts for assessing the quality of meta-analyses could translate to systematic reviews. So this was basically trying to take care of that poor quality and poorly organized articles problem. This Quorum statement was put together by 30 clinical epidemiologists, clinicians, statisticians, editors, and researchers. And what they did was they identified items for a checklist of standards with evidence if possible, although the state of the evidence was not particularly good. What they did was a modified Delphi process. Are you familiar with the Delphi process?
Yes, I am. Yes, I am.
Do you want to, for our listeners, just give like a quick and dirty rundown of what the Delphi process is?
It's just
you don't have to. I can.
You just ask a bunch of people if they agree on something.
Yeah, and eventually they do. So then, along chugged the Quorum statement, improving the quality of our meta-analyses in literature, until 2009, what another group of clinicians, etc., did was they updated it to PRISMA, which stands for Preferred Reporting Items for Systematic Reviews and Meta-Analyses. So instead of just including those meta-analyses in the quality control, they started to add systematic reviews as well. So this was constructed by 29 participants, including review authors, methodologists, clinicians, medical editors, and a consumer. I don't know who the consumer was. What do you think a consumer is for something like this?
I didn't know if it was someone who works at the journal.
But that would be considered like an editor or something. Like, is there a consumer position at these journals? Or did they just find someone at Walmart?
Just go to the nearest Target and...
You, consumer!
You, the one next to the underwear aisle.
Your feedback is necessary. PRISMA! So these, the updates that they made from Quorum to PRISMA address the risks of bias in reporting, the source articles, and the determination of quality. And they wanted to include systematic reviews in the quality assurance, like we just talked about. So I have linked in the show notes the differences between Quorum and PRISMA, but they go by section, so abstract, introduction, methods, etc. And it says specifically things like, the new item in the methods asks authors to report whether the review has a protocol, and if so, how it can be accessed. So it allows people to better look back into the source material if they want a specific protocol for some sort of intervention. And if there isn't one listed, they say that, which is great, because if you want to use an intervention on a patient, you should know what to do.
The biggest difference, if I remember correctly, is between PRISMA and Quorum is the methods.
Actually, I'm not sure, but it looks like on this lovely picture, there are 4 different changes to the methods sections, where all the other ones had 1 or 2.
Yeah, it was kind of the biggest thing they changed.
Yeah. So, what is the PRISMA statement? Its goal is to help authors improve the reporting of systematic reviews and meta-analyses. It consists of a checklist and a flow diagram and is intended to be accompanied by the PRISMA explanation and elaboration document. And it was published in Public Library of Science Medicine, which means that anyone can access it. You can see in a lot of systematic reviews and meta-analyses nowadays, the PRISMA flow diagram, which talks about the different phases such as identification of different articles, how they screened out other articles, and they specifically have to state why they screened them out instead of something like, we discussed it and said no. They had to say no because the patient population does not match our population of interest.
That's respectable.
Definitely. The final question is, why should I, as a rehab clinician, care about it? Why do you think we should care about the PRISMA statement, Tali?
As I said, it's because we base our knowledge and we base our practice on those articles.
Absolutely.
And it's important for us to know that our research of quality, that somebody didn't just say, oh, we found this, and we, it's not Pinterest. It's not oh, we thought that might interest you.
It's not Pinterest.
It's not Pinterest.
You're right. You're totally right. It's just not garbage you find on the internet that would look really cute in your foyer.
And not only that, it's not. Oh, I heard about that method, and it seems cool.
So another thing, along with what we were discussing about how We want to have quality information for our patients. Say that you are someone who really likes research and wants to publish a systematic review, which anyone can technically do. If you have access to the journal articles, be it you're part of a large academic institution, save yourself the headache and use these guidelines instead of having to go back and redo everything when you're getting ready for publication. I speak from experience.
Oh, yeah.
Yeah, I've had to do a lot of editing. It's a bummer. So then some journals don't require the PRISMA guidelines, which, I mean, as a clinician, you should know about because their content is at a higher risk of unnecessary bias. I do want to mention that there is a problem with the PRISMA guidelines. They are not perfect. One problem is that they don't address publication bias. And publication bias is this problem where, in general, things that don't have statistical significance in their results do not get published. So this doesn't address that issue. So like say someone does a beautiful systematic review and meta-analysis of this particular intervention in this particular population, and they find that the intervention doesn't do anything, they're much less likely to get published. And the PRISMA guidelines don't address that at all, which I think there's that risk of bias, and that is problematic.
It is a risk. Also, I personally think we learn from things that do not work as well.
Preach.
And it's a shame that a lot of systematic reviews or articles or meta-analysis or whatever articles are not published because they didn't find a significant change or, or the results they wanted to find.
Right.
I think it's one of the biggest biases.
Absolutely. And unfortunately, the PRISMA guidelines, as imperfect as they are, do not address it. So what's fortunate is that the PRISMA guidelines are a living document and they're constantly being updated. So say if you find something about the guidelines that you are critical about and you think that aren't correct, you can always contact the PRISMA folks. The link to the PRISMA guidelines will be in the show notes.
To be fair, I don't think that if a journal doesn't use the PRISMA guidelines, it makes it not as good.
I agree.
Or to make whatever you read there invalid. It's just that it's important to know which one uses it and which one doesn't.
Right. Like, it's a matter of being more open to the risk of bias. So if a journal doesn't use the PRISMA guidelines, you're going to want to assess the quality of their content a little more carefully. That doesn't mean their content is bad. It's exactly like Tali is 100% correct.
And to be fair, I have not met anything that it doesn't have bias.
Thank you all for listening. I'm Erinn Carey.
I'm Tali Spaceman.
And if you have any more questions about the PRISMA guidelines, or you want to tell us about how much you loved or hated this episode, please email us. Our emails are in the show notes. And if you have any articles that you want us to talk about on the shorts component of Senior Rehab Podcast, please email us. We love to hear from you.
We love to hear from you on email, on Facebook group. It's always a pleasure to hear what you think we're doing right, what do you think we're doing wrong, and what you want to hear about.
Absolutely. All right. Anything else you want to say, Tali?
No, Erinn, except for congratulations to Dr. Erinn Carey.
I graduated. Thanks, Tali. I'm a DPT now.
Yes, she is.
And on to boards in October.
We all wish her well.
Thanks.
In the wars to come.
All right. And as always,
stay funky.
Hit me. Thank you for listening to the Senior Rehab Podcast. If you enjoy this content, I highly encourage you to go to seniorrehabproject.com where you can find more helpful episodes, lots of free resources, and to see how you can become a game changer and influence the direction of this movement. I appreciate you, and I'll talk with you soon. But in the meantime, do not forget to stay funky. The Senior Rehab Podcast is sponsored by Great Seminars and Books. If you need high-quality geriatric con ed that's worth your time and money, check out Great. Owned by the living legend Carol Lewis, Great offers courses and products created by recognized leaders in geriatrics. Learn the most effective techniques for diagnosing and treating your patients. Just go to seniorrehabproject.com/great and get $25 off by using the code SRP25. This podcast is brought to you in partnership with the Geros Collective, a podcast network that's redefining old and equipping healthcare clinicians to better serve our aging population. Find out more at GEROScollective.com.